Breast reconstruction is usually done following breast cancer surgery to rebuild the contour of the breast. We spoke with Dr. Robert Brueck at Associates in Cosmetic Surgery about this procedure, which can help restore confidence after this traumatic time for a woman.
When you talk about breast reconstruction and breast cancer, there's two facets of it. The first one is the extirpative part. In other words, a general surgeon goes in there, does a quadrantectomy where they take a quadrant out. It may be subsequent radiation or chemotherapy. The operation may be a simple mastectomy where they just take out the whole breast. It may be a modified radical. Now what's interesting, as time has gone on, the degree of radical surgery that people are doing has lessened, because now we have long-term studies that show that perhaps just a quadrantectomy or a large biopsy with normal tissue followed by radiation and chemo is just as efficacious as the more radical. I don't think anybody today is doing the radical mastectomy where it involves the muscle of the pectoralis muscle, the chest wall. So there's less and less radical degrees of surgery being done today. And most of the breast reconstructions we do now are usually done as an outpatient or a short stay. In other words, patient is admitted in the morning, they have the surgery, they stay for 20 hours, they go home before the next breakfast.
Dr. Brueck discusses how he achieves as much symmetry as possible.
The one thing I tell people, it's like before we even step forward with the first word, I tell them, you're never going to be perfectly symmetrical. Now, I don't say that to mean that breast reconstruction isn't worthwhile. That's not what I'm saying. But I say to people, in 32 years of doing this and having done hundreds of patients over those years, breast reductions, breast augmentations, breast reconstruction, nobody in my 32 years have I ever met that's symmetrical. So guess what? You're going to be part of the family. You're not going to be symmetrical. And many times when we do a breast reconstruction, we have to work on the contralateral breast. In other words, you have the mastectomy side, but the other breast may be large and ptotic, or it may be small, so we might do a concomitant augmentation so that she has a fuller bust line.
A breast reconstruction can help a woman regain her self-confidence.
You know, just like for a man, having a full head of hair is part of his masculinity, part of his handsomeness, its good looks. A woman's breasts are a part of her femininity, you know, and it's not a chauvinist statement, but it is part of who she is. Just like a woman who has 3 or 4 children, has a lot of stretch marks, is embarrassed about the physical appearance of her body. And many women will come in, and it's a very emotional time. They're very embarrassed, even sometimes embarrassed to tell me. When I make love to my husband, I have to turn the lights out. I don't want to face him because I don't feel complete. And thank God, the majority of husbands are very, very, very supportive of their wives. And so when you go ahead and restore that breast to that woman, it changes who she is, it changes her demeanor, her sense of confidence. That when she goes to bed at night or when she goes in to take her evening shower, she takes her bra off, her breasts are there. It's not like I got to put the prosthesis on the table. It's extremely emotional. And sometimes I'll see people 2, 3, 4, 5 times before we do the actual surgery. And many women will say to me, you know, Dr. Brueck, I've struggled with this for 3 years, 5 years, to feel worthy enough to come in and have this done. You know, part of me left 3 years ago when I had that. And they say, I'm thankful to have my life, but now I want to complete my life.
For more information about Dr. Brueck or Associates in Cosmetic Surgery in Fort Myers, call 1-888-287-9033, or you can visit beautybybrueck.com.